Sensitive skin. Cannot tell you how many times over the last 20 years I've tried to help patients get on the right skincare routines, use a specific type of laser or a chemical peel, and the answer to my admonition is I can't because I have very sensitive skin. This is probably one of the greatest barriers holding so many people back from being able to achieve excellent, real anti-aging. And in today's video, we're gonna talk about some common mistakes that people make when they have sensitive skin and how to break through some of these barriers. I'm gonna give you my insight from clinical practice, but also what I've researched and learned. I think you're gonna find this video extremely helpful and extremely interesting. Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, we're gonna talk about a topic that I believe is extremely important and one that I think is much more common than we realize, and that is the topic of sensitive skin. In today's video, we're not just going to discuss what sensitive skin is and what it looks like and how to differentiate it between that and true allergies, but we're also going to really understand what types of mistakes you can avoid to improve your condition and help yourself get through some of the challenges if you are somebody who believes they have sensitive skin. Because quite frankly, there are so many important things that you need to be doing to prevent and restore your skin from the changes associated with aging that having sensitive skin hopefully won't be a reason why you can't participate and partake in some of these things that are gonna be so beneficial for you in the long run. So if you or anyone else has sensitive skin, this is the video you wanna watch. Make sure you share this. Also, as a gift to you, I've prepared a PDF which basically summarizes many of the important points that we're gonna discuss here as almost like a guidebook or guidelines of things that you need to think about and be aware of as you navigate with sensitive skin. All right, folks, so without further ado, let's break it down. So what does sensitive skin look like? Sensitive skin basically is skin that is more prone to reaction to some type of thing that you're doing to it, whether it's the use of a product, whether it's the environment, whether it's the temperature, whether it's a treatment. And what people complain of when they have sensitive skin is that the skin is more red, it's more itchy, it becomes more irritated, it becomes just all around not looking and feeling great in response to the treatment or whatever variable that has been added. And as a result, the self-diagnosis of sensitive skin type becomes applied. So what would be the causes of sensitive skin? Well, frankly, it could be partly genetic. It could be related to aging. Some people note that their skin becomes more sensitive as they get a little bit older. Some people feel that it is specific to certain types of individual products, certain pollutants. It's also a function of or a symptom, I should say, of a skin barrier that is not functioning as well. And we've talked about skin barrier and how important skin barrier health is. And when the skin barrier is not as healthy or it's been affected somehow, well, skin sensitivities go up. So this is gonna be a nice opportunity to understand and try to pinpoint where these things may exist in your own life, in your own continuum, and what you can do to basically mitigate them. Common triggers that people complain about or describe in terms of correlation with it tends to be changes in temperature, exposure to certain pollutants, etc., as well as exposure to certain new treatments, whether it's a skincare product or whether it's like a chemical peel or some other thing. What are the symptoms? What does the skin look like? Well, the typical things are gonna be like redness, irritation, burning feeling. Dryness is another big one that people complain about a lot. And some people even have rashes or breakouts as a result of whatever exposure they're gonna have. So as you can see, there's a lot of different ways people describe sensitive skin, but basically the way I think about it is responses to some type of an exposure that is leading to a negative effect on their skin. And that translates to the notion of sensitive skin. It becomes like sort of a catch-all for all things negative upon exposure. How do you diagnose it? This is not something you can go to your doctor or your dermatologist and say, hey, check me out to see if I have sensitive skin type. the reality is there's no test for it. There's no real way to diagnose this. So as a result, it becomes like a self-assessment, self-evaluation. Again, exposure, repetition, every time I try this is what happens. Again, I can't tell you how many times I hear, I can't use vitamin C, for example, because I'm sensitive to it, or I can't use retinol because I'm sensitive. I have sensitive skin, I can't use retinol, it's too harsh on me. I'm gonna explain a lot of that in a minute, because this is some really important aspects that I think can be overridden, and you can enjoy vitamin C's and retinols and some of these other things, but we're gonna understand how you can avoid the mistakes that lead to it. But it's important to know that it's not a clinical diagnosis. It's not something that your doctor can actually test you for and then say, hey, yes, you have this, or hey, you don't have this. And even though there's no direct correlation, I would say, with age, I think when you talk to people with sensitive skin, they do feel that as the years have gone by, they enter their 4th or 5th decade, that their skin has become more sensitive. And when we get to this part of the video, I want to explain this a little bit better, because it might not be like you're becoming more sensitive, right? That's an important point. It might be that there's certain aspects of your skin that need to be addressed so that you can tolerate certain things better and not respond in a sensitive way. And I'm gonna explain all this in a second. But before we do, let's talk about some of the common exposures that lead to skin sensitivity. One of the biggest ones is weather. So for example, cold weather that's dry, mountain air, certain parts of the country where the air is cold and dry, strips the skin of moisture, and as a result, causes the skin to become much more susceptible to sensitivity. So in these cases, a lot of people describe that particular time of the year that their skin can't tolerate products that they normally have been able to tolerate. Their skin becomes more red, more irritated, more burning, all the simple symptoms associated with sensitive skin, but specifically seasonally. Interestingly, on the flip side, heat and humidity can also create the same type of exposure-related sensitivity as well. So for somebody who has exposure sensitivity to cold months of the year, and they also have it for summertime, that gives them basically 2 seasons where their skin is responding more favorably and more tolerantly than half the year, which is kind of a bummer, but we're gonna talk about that. Wind exposure is also one of those things where your skin gets basically dried out by high wind exposure, chaps the skin, it dries the skin. So now I think all 3 of these things under weather, we're specifically talking about skin barrier. And this is gonna be an important aspect, because I'm gonna describe to you what you can do to basically mitigate some of these changes that are temperature and wind and weather dependent. Another big one is the properties of the water that you're using to wash your face or being exposed to. So for example, tap water, and specifically in certain parts of the country, is very hard. It's rich in minerals like magnesium and calcium. And sometimes that residue that forms on the skin leads the skin to become much more susceptible to sensitivity. Also, water that is highly chlorinated. Again, tap water tends to be chlorinated for disinfection and keeping bacteria counts low, etc. But also chlorine can become an irritant to the skin. This is one of the categories of external pollutants, for example, that can cause the skin to become more irritated. On the contrast, soft water can also be a little bit too soft and cause skin issues because of the salt content used to soften the water. So it's interesting that if you have sensitive skin, you might want to check what type of water condition that you have and try to alternate or change the different type of water conditions in your environment to see if your skin is going to become less sensitive according to those changes. So if you have hard water, see if neutral environments can be a little bit better. If you're highly chlorinated, see if you can reduce the chlorination aspects. Again, there's a lot of filters and a lot of different things that can be done. Many times it's hard to do that in your main water source, but sometimes you can do that specifically to a sink or wherever that you're gonna be washing your face, etc., that you can improve skin sensitivity by changing the chemical composition of the water that you're using. A very important distinction that I think is critical to make is what's the difference between sensitivity and allergy? And this is one that you really want to get right, because If you're using a new product, for example, or using some new ingredient, and you think your skin is sensitive, but in fact you have an allergy, there's a big difference between those two, and the difference can be very, very important and even life-threatening in some cases, because sensitivity is benign. There's no issues associated with sensitivity in terms of creating a problem for you. It's just kind of irritating and annoying. But an allergy, depending on the severity of the allergy, can be something that can lead to potential anaphylaxis. And anaphylaxis, that's the most extreme type of an allergy you can have to some type of stimulant. And if you have that type of a response, well, that could become a medical emergency where your tongue swells up and your throat constricts and you're basically gasping for air, etc. So you want to make sure you don't assume that certain types of responses in your skin are due to sensitivity when in fact they're an allergy. So how can you tell the difference? The biggest difference is an allergy tends to be much more widespread. So you're gonna have kind of like general itching, you're gonna have more generalized swelling, you're gonna even have potential rashes like hives that are forming in different, throughout your body. And of course, if you get any kind of like symptoms in your mouth or your tongue where you're tingling or swelling or any of those type of things, that's much more of an allergy. So think of allergy as a bit more widespread, a little bit more generalized, whereas a sensitivity is local. It's very, very local to the particular area. Now, there are early stages of allergies that can be more like a contact dermatitis or some type of contact-related allergy that doesn't create generalized changes, but I think if you have that type of response and it's happening at that time, it's a good idea to get checked out by your doctor or your dermatologist so they can have a look at the rash or the redness or whatever it's going on in real time, or at the very least a photograph of it, and be able to give you some guidance of whether this is an allergy or whether this is sensitivity. Because if it's an allergy, sometimes allergies can get worse with more exposure, sometimes they can actually get better, but the bottom line is you want to try to avoid it as much as possible. So getting that right and trying to correlate what it was that you might be allergic to is paramount, because then you can start making good decisions for your health as opposed to basically assuming that something is related to just a sensitivity and then, God forbid, you're on vacation somewhere far away from medical attention and then you use that particular product in one way or the other, and next thing you know, you're having a more severe reaction to it. All right, so now let's break it down into the common mistakes to avoid. I'm gonna put melasma in this category. I know we've done several videos on melasma, which I think is really important. Some people describe their response, for example, to lasers or chemical peel, which is sometimes gonna be an increase in pigmentation and darkening of their skin. They assume that's a sensitivity. And in fact, it's because of melasma. And melasma can be very faint, and then when you expose it to lasers or chemical peels, some type of stimulant like that, you're gonna end up suddenly becoming a lot darker. And the key point here is that if you have melasma, generally speaking, it's, you can self-diagnose it because it's usually like patches of darkness in, throughout different aspects of the face, like the forehead, the upper lip, the cheeks, etc. But if you ever, really want to get to the bottom of it, you can definitely get checked out by a dermatologist to differentiate that between melasma versus just sun damage, and usually you can, because sun damage is more broken up, it's not as coalesced, and that's an important aspect. But the key point here is something to avoid if you have melasma is you don't want to do lasers, you don't want to do chemical peels, because that can highly exacerbate the condition. That's really important. So a good alternate treatment for your skin, if you do have melasma, for example, is you want to use topical agents, not expose it to harsh treatments. So basically things like retinol, vitamin C, if it's more severe, hydroquinone, azelaic acid. These type of topical treatments can be used for melasma to improve the discoloration, but also safely be used on the skin without exacerbating the melasma. Now, let's switch gears to the other extreme, which is rosacea. Rosacea is defined by sort of reddish hue to the skin, usually around the cheeks. It can also be a little bit of bumps that occur. Now, rosacea is one of those conditions is actually a lot more common than people think. And when they have an underlying rosacea, they can mistakenly think that they have sensitivity, because when they put on certain products or do certain treatments, the skin is going to become much more red and much more, irritated. The things to avoid are things like exfoliation, heavy, hardcore exfoliation, like harsh microdermabrasion, chemical peels, scrubs, for example. A lot of these things can exacerbate the underlying rosacea. So when you have rosacea, you gotta think gentle. Everything has gotta be gentle. Exfoliation has to be very gentle. We did a whole video on different types of exfoliation. We, as a brand, landed on a enzymatic exfoliator as opposed to harsh irritation types, as well as chemical peels to exfoliate. Because if you have rosacea, those things can exacerbate it. So a enzymatic exfoliator, in our case called polish, can basically exfoliate in a very gentle way, be used in all different skin conditions. But keep in mind, that is a very, very big and important aspect of it. And the same thing goes for cleansers. Cleansers that are gonna be harsh. A lot of cleansers are gonna have a lot of suds associated with them. That can be very harsh when they have sulfates in them, for example, as well as some of them have exfoliating beads in them, like bamboo and things. Those are not good in these type of conditions. So think gentle cleansing and also gentle moisturizing in cases of rosacea. The next is the cases where you use a product and you break out. That falls under the category of skin sensitivity, because again, one of the symptoms of sensitive skin types or self-diagnosed sensitive skin is that, I've formed acne according to whatever I've just used. Acne-prone skin, avoid clogging the pores. So using non-comedogenic products that are not gonna clog up your oil-producing glands and therefore creating a backup and therefore setting up for an infection is the key. So if you have that type of skin, which is prone to it, you want to avoid everything that, like heavy oils, things that are gonna basically clog up pores. You're gonna be thinking exfoliation is very important to remove all the surface debris from the skin. Even, for example, in this case, you can use light acids like salicylic acids, for example, to exfoliate, in addition to enzymatic. Exfoliation is also helpful in these conditions, but you want to think light products, things that are gentle on the skin, that are not going to clog up pores, are very, very important. So in summary, for acne skin, just think regular exfoliation, regular cleaning, use of salicylic acids, use of benzoyl peroxides, things that are gonna keep the surface of the skin as clear as possible so pores don't get clogged. That's how you can manage acne-prone skin and then be able to use a lot of different types of active products on your skin without leading to a lot of the issues associated. Keep away from the heavier creams and heavier moisturizers and oil-based type of things. Eczema is the other manifestation. Eczema is basically like an atopic dermatitis. It's a sensitivity where your skin's gonna become more itchy, red, inflamed. Use certain type of products is gonna become sensitive to it. So here's the deal with atopic dermatitis or eczema. You want to avoid things that have alcohol in them. You want to avoid things that have fragrances in high concentrations. You want to avoid things that are gonna expose you to a lot of different chemicals. So hypoallergenic, as clean of a product as you can possibly have, is really, really helpful in these conditions. And when it comes to moisturizers, a barrier cream is also a very good way to go, because it basically keeps the hydration levels high in the skin by preventing the skin from losing a lot of water, as opposed to having to use chemicals and different things that are going to basically penetrate into the skin and potentially irritate the skin. So if you have dry skin, in addition to this, a barrier cream is really good. Now, if you get a flare-up or some other thing, your dermatologist might prescribe you a steroid cream, or you can pick up some topical steroid at the pharmacy. But ultimately, keep things as clean as possible, keep the chemical counts as low as possible. This is the way you can manage situations with eczema. So if you have hyperpigmentation, basically sun damage, and you have sensitive skin and you're like, what can I possibly do? The number one thing you can do is sun protection, because if you can decrease the amount of sun exposure that you have, then when you basically are not increasing the amount of production of melanin, etc., your skin is going to be in a much better position, and you don't need to expose yourself to a lot of chemical peels and heavy lasers and all that other stuff. So that's a really important aspect. A lot of people with sensitive skin in particular combinations can use the products like vitamin C, etc., to decrease pigmentation production, but none of it is worthwhile if you're not using sun protection. So if you have hyperpigmentation and sensitive skin, Make sure sun protection with the right SPF, and we've done several videos on this, as well as several videos on how to manage hyperpigmentation. Very, very important. So recognize that is priority number one, and then try to use the anti-hyperpigmentation products that you can tolerate, but don't do that without sun protection. This next one is one that I think is extremely, extremely important, probably pertains to many of you. If you're aging and you want to use a retinol, Retin-A, retinol, any of these, derivatives, and you find that your skin becomes red and irritated and you just can't tolerate it, you may assume that you have an allergy or a sensitivity, or your skin simply, it's unable to manage it. And the reality is, it probably is. And I'm gonna explain this to you in a second. It took me a long time to understand this, because for literally 20 plus years, I constantly put my patients on retinol. You've seen several videos that I talk about this. I'm a big believer in retinols as a critical part of an anti-aging regimen. That's a huge reason why I included it in my trifecta skincare routine, because I think without it, you're missing out on a lot. But here's the reality. Very, very few people can tolerate retinols or Retin-A. Very few people. So if you're one of them, you're not alone. What is the remedy, right? So the remedy is not to use it like once a week or twice a week or whatever, which I can't tell you how many people think that that's a useful way to approach their anti-aging, retinol use. That doesn't do anything, because what you're trying to do is with retinols is you're trying to turn on the DNA to make more collagen. That's really, at the end of the day, decrease pigmentation, increase collagen, make the skin look younger, right? But doing it once or twice a week is just not enough to get momentum going and get the changes. It really ideally should be done every day. But what do you do if you can't tolerate it? Well, this is the challenge, and I think there's a lot of myths around this, but I think one of the challenges are, if you're using it in the concentrations that majority of the retinols and Retin-As are out there, even the minimal doses of them, it's probably too hard for your skin. And it took me a long time to figure this out, because again, I was insistent that retinol would be included in my anti-aging routine. So what I did, after doing a lot of research on it, realized that it doesn't have to be high concentrations. As long as it's at a certain concentration, it's imparting the changes that you're looking for. And the beauty of it is, in the lower concentrations, what it's doing is it's much more tolerable to the skin. We have also taken it to one step further, which there's all these new generation retinols, for example, but the one we included in Illuminate is a slow release retinol, and I'm sure there are other brands that have this out there. But you want to make sure that your skin is not getting bombarded with retinol. That was our thinking. We didn't want the skin to get completely bombarded with the retinol all at once, and therefore the skin could handle and tolerate it. So we divided our doses twice a day, slow release, light concentrations. A lot of people who use our products thought they have extremely sensitive and could never use retinol. So there is hope out there, is what I'm trying to explain to you. And if it's not our product, there's gonna definitely be other ones that have to adhere to this type of thinking, because if you can get retinol into your routine, you're gonna be way better off. Additionally, if you can recognize that response or reaction you're having to retinol is not necessarily a sensitivity that is specific to the particular product. It is a universal response, because even the ones who do eventually get on Retin-A or retinol every single day, they usually go through about a 2-week period where their skin is going to be red, flaky, irritated, swollen, all that kind of stuff, and then they acclimate. Okay, so recognize that aspect of it. These are some of the hacks around it that I just mentioned. For more information, obviously, check out some of our stuff. Now, the next category is dryness, right? So if you have dry skin and you're using a product, or you're using something that is actually drying your skin even more, well, guess what? You're gonna tip it over the edge and you're gonna feel all the excess dryness and all the other stuff that comes along with it. So if you have dry skin, it's extremely important, number one, to avoid things like alcohol-based products, soapy, sudsy cleansers, all the things that can potentially dry your skin more. What you want to do in those kind of situations is you want to use a product that has hyaluronic acid in it, that pulls in a lot of water, hydrates the skin. It's very well tolerated on sensitive skin, and it plumps up the skin immediately, brings in a lot of water, gets the skin hydrated. It's a beautiful, beautiful ingredient in skincare, used specifically in cases where there's dry skin. Glycerin is also another one of those products that can create that type of an environment. Additionally, what you really don't want to do is you don't want to exacerbate water loss in the skin. So that transepidermal water loss that happens because of, air conditionings and heaters and wind and all the other things that we talked about, and just literally sleeping overnight, you lose a ton of water through your skin. Using an emollient barrier balm, in our case, we've developed the Enrich product, which is basically a breathable barrier balm, but it's the same concept, in this case, just a lot easier to work with and cleaner, et cetera, and non-comedogenic, as using, for example, like a thin layer of petroleum jelly on the skin, right? And the concept of slugging can be very, very helpful. Keep the water from being lost in the skin through some type of barrier balm. Additionally, avoid things that are gonna cause more water loss through the skin. That is an important way to manage it. So hyaluronic acid products, controlling loss, that's the way to improve the condition. That ultimately will improve your dryness. That's probably one of the easier, concepts to correct. All right, so let's talk about skincare routines. You've heard me talk about this a lot, that skin aging is multifaceted. There's discoloration, there's dryness, there's loss of collagen, there's changes in the oil composition, decreasing, increasing, pores are increasing, etc. All these things are happening with aging skin. As a result, you end up needing a lot of different products to address different aspects of the skin. We've talked about this before. I'm going to do an entire video on constructing the ideal skincare routine or the ingredients, etc. So look out for that. But sometimes when you're using products from different brands and different concentrations and all this other stuff, you end up with like 6, 7, 8, 10 steps in your routine, sometimes more, and that's just too much for the skin to handle. I mean, that's a lot for a skin to just get bombarded with stuff. So for a lot of people, those multi-step routines become overwhelming for the skin, and as a result, people back out of it and stop using it, etc. And again, this is by no means a plug for the trifecta, but I do want to explain my thinking and how I rationalize this. Understanding how skin ages, I recognize it needs all these different things. It helps when you formulate a product that includes all those things together because the chemistry is synergistic, it's compatible. So as a result, your skin doesn't feel like it's getting overwhelmed with a bunch of different products, with a bunch of different pHs, a bunch of different, sort of concentrations, etc. It's being done in a very deliberate way. And one thing I will say, when we developed the trifecta, for example, my number one thing to the chemists in the laboratory was, it needs to be compatible with the most sensitive skin types, period. In fact, I had probably like 20 people I knew that could never use skin products at all. And literally I kept them as my last, sort of treatment group, my research group for the final rendition of the product, because if they could tolerate it, I knew everyone else could. And lo and behold, yes, we got retinol, vitamin C, niacinamide, all these important things in the skin, and people could tolerate it. This particular group, that's when I knew we were ready, and we, subsequently launched with that particular formulation. But my point here is that too much can be really hard on the skin. So be mindful of it. If you're using different products, you may have to start making decisions. Certain things that you want to kind of avoid, certain things that are priority. And I would say, from my point of view, the most important anti-aging priority ingredients are things like retinol and vitamin C and sun protection, right? Those are the big ones. Everything else definitely makes a big difference in the skin, but nothing makes as big of a difference as those two in terms of anti-aging. So keep that in mind. If you're overloading your skin, that might be too much for it. Believe me when I say this, years ago, my wife was doing microneedling, she was doing hydrofacials, I think it was like once a month. She was using retinols and retin-A, this is all before trifecta, etc. And honestly, her skin was kind of reddish to me, had like a little bit of like an irritated redness to it. I literally diagnosed it as she's doing too much to the skin. All these like too much of a good thing kind of a situation. So we backed off a lot of that stuff. Now I think it's like every 2 months she does a hydrofacial. Every 3 months or so she does a microneedling, mostly just for her neck, just to keep the neck skin from thinning. And she does the trifecta, and she's not on like 10 different things when she used to be on. Her skin just looks so much more rested and soft as a result of it. So keep in mind, if you're starting to see this in your own skin, that's, could be you're doing too much to it. Your skin should not look, sort of like it's going through something. And by the way, when it comes to product, your skin should never feel that intense burning feeling or stinging, as they call it, or have a sensation. Like if it's feeling those type of things, some people perceive that as, oh, something is working. That's not right. Like, your skin should not feel those type of sensations when you're using any type of skincare product. Next, we're going to talk about exfoliation just briefly, because if you're a person who is having a little bit more mature skin and you recognize that you need to start exfoliating to get that dullness off, get the skin to become more brighter and smoother, get the textural changes, sometimes over-exfoliating can make the skin very, very sensitive because it's affecting the skin barrier. Not exfoliating at all can also cause the skin to become more sensitive too, because it doesn't have a functional skin barrier as much of once you start getting those dead layers of skin on top of the epidermis. So there's a very, very, appropriate balance to get to where you're exfoliating, but not exfoliating too much. You're not using too harsh of chemicals to do it, for example, like using chemical peel too often or using microdermabrasion too often. As a category, the enzymatic type of at-home exfoliation once or twice a week tends to be extremely safe for all skin types. If you're not exfoliating at all, try to get some exfoliation into your routine. If you're exfoliating too much, maybe back down a little bit to a point where your skin feels is tolerating it. All right, so here's a very common and easy thing to address when it comes to improving skin sensitivity. So it's skin hygiene, right? So here are my recommendations. The skin throughout the day picks up a lot of pollutants, irritants, you put sunscreen on, you do this, you do that, all this other stuff. Washing it twice a day with a gentle cleanser is extremely, extremely important. You don't want to use something that creates too much foam. A non-foaming, gentle cleanser is really, really important. That's, again, we think of all these things as in our product called Rinse, for example. There's a number of them out there, obviously, that have similar qualities, but you want something that is extremely gentle. You want to use it twice a day. If you're using something that's harsh, you're actually doing the opposite problem. You're drying your skin, you're setting yourself up for failure. So something that is not going to dry your skin, that is washing your skin, cleaning all that stuff off is extremely important. Additionally, you want to clean the things in your environment. So regular cleaning of your wash towels, when you use to dry yourself, to wash yourself. You also want to make sure your pillowcases are being cleaned on a regular basis, because once again, these things, if you have pets or you forget to wash your face, all that stuff gets picked up on those linens. And as a result, next time you touch your face with it or you sleep on it, your skin's going to be much more sensitive. And it's going to be, potentially set up for bacteria and acne and all the other things that come along with it. So hygiene is a huge and important part of just good skin management. On that same note, people don't realize their makeup brushes pick up a lot of bacteria as well. And you're reapplying throughout the day, then it starts picking it up. So that can be another source of transmission for a lot of environmental pollutants and bacteria and things like that. So make sure your makeup brushes are being washed on a regular basis. Additionally, your phone, you push your phone against your face, you're picking up a lot of stuff. So keep your phone clean on a regular basis. But one of the best ways to all around mitigate some of this stuff is to get to the starting point, in addition to cleaning your environment, but also making sure your face is being cleaned on a regular basis, because the hygiene aspects can definitely heighten any type of skin sensitivity and be a source of a lot of the things that we're talking about here. All right, folks, that was a lot of things to think about, things to avoid, things to do to avoid making some of the mistakes associated with sensitive skin. But I want to summarize things in just a very simple way. Skin sensitivity is a real thing, no doubt. When it comes to skincare, again, I'm thinking of it, I'm a surgeon, I developed a skincare formulation. I did it with a lot of intention. I did it because my patients were having issues. I wanted every single person to be able to get all the things that are related to anti-aging on their skin so that they can see the type of results that we're now seeing with the trifecta. I want to make a couple points here. If you feel that certain active ingredients are too much for your skin, recognize that much of that can be related to the type of product that's in there, the formulation of the product, as opposed to just throwing the baby out with the bathwater kind of a concept that you can never use a retinol. As I mentioned earlier, certain formulations, certain philosophies, our philosophy is light doses, split twice a day, slow release. That's how we've gotten around the sensitive skin type issues that a lot of people are having when it comes to skincare and things that actually work. So I think this is the really important aspect. People with sensitive skin avoid the stuff that actually is going to make real changes in their skin. And that's the shame. That's like, breaks my heart when I hear about that. Because at the end of the day, if you're not addressing actively the changes that are happening with skin during the aging process, your skin is only going to get older and older and older and show all those signs, fine lines and wrinkles, thinning, crepiness, dehydration, pores, discoloration, etc. Only gets worse. So it really is a matter of in my opinion, it's kind of a necessity if you're trying to fight the aging process that you do it using these particular individual actives. So look for brands that have that mentality, that understand and empathize with the sensitive skin issues. Some of the things that I just mentioned here definitely are good practices. From a formulation point of view, don't be afraid to try certain things, but recognize that trying things that are just the same as the other one, you're probably gonna have the same result. So if it's a 0.05 retinol from another brand is gonna be the same general thing. So understand that you might have to switch things up and try something a little bit different. And again, just for those of you who are interested, all of our products are literally designed with the default of being available for the most sensitive skin types. I mean, this is just the conscious, effort that I made to do that. So if it's not our brand, look for brands that have that type of conscious, deliberate approach, and you'll probably be able to tolerate it and see the benefits of using these type of things. Protect your skin barrier. Use a barrier balm. I think it's one of the best things that you can do to protect the skin and keep the skin barrier healthy, because at the source of a lot of these things is just an unhealthy skin barrier. And the function is something that we're learning more and more about the importance of. Not being too dry, not being, too over treated is an important aspect of it. And barrier balms can be very healing and very nurturing to the skin. And that's why we developed the Enrich, for example. But if you want to use something that is really simple to use, although it does have a comedogenic, meaning acne sensitivity issues and sometimes allergens associated with it, but using petroleum jelly products can be very, very helpful if you are on a budget and want to just use something that is going to be helpful in that way. Those are my most thorough thoughts on the topic of sensitive skin. I hope it helps you. Again, each one of these things, are specific to certain people, or that you can be a number of them associated with you. So think about which ones might apply to you and make the changes associated with it. And I wish you the absolute best and hope that you get where you want to be without having to worry about the sensitive issues associated with skin. Also, download the PDF. A lot of this stuff is going to be summarized on there. So download the PDF so you can use it as a quick reference. You can go to the areas that you're interested and concerned about. We'll also have a blog on the topic as well in our newsletter, KaramMD Journal. If you enjoyed this video, hit like. If you're not a subscriber, make sure you subscribe. I want to see you back here for the rest of my videos. If you have some questions or comments, enjoyed the video, have some things you want to add, drop them in the comments. I will do my absolute best to answer them. And make sure you send this to some friends and family, because again, sensitive skin is a real thing for a lot of people, and I hope to be able to help people navigate through the issues. All right, folks, thanks so much. Dr. Amir Karam.